So I'm going to go ahead and get started. This is the January 4th, 2021 on our packet. We have some typos here. And it is not our December meeting. It's our normally January meeting. So we're going to start off the new year right and get everything corrected here. Of the Health Committee to order. Okay, so first of all, we have all members present. I'd like to welcome the members that are new to the committee, and one of the members is actually a new member of the board, so welcome. And all members are present, so we have a quorum. We have minutes to approve from October 21st, November 17th, and November 30th for to be approved. So do I have a motion for those minutes? Motion by Martin, second by Bloomfield. Any additions, corrections? Hearing none. Ms. Morlock, would you please call the roll?
Member Bloomfield.
Present.
Member Martin.
Yes.
Member Metzger.
Yes.
Member Chung.
Yes.
Member Johnston.
Yes.
Member Beer.
Yes.
Chairman Schaefer.
Yes. So the minutes are approved. Do we have any appearances by members of the public?
Yes, we do, Chairman Schaefer. Ms. Morlock is poised to read two comments from two separate individuals.
Okay, thank you. Ms. Morlock?
The first one is submitted by Zachary Gittrick. I am writing you because I was very concerned to find out there were new cases of coronavirus in the McLean County Jail. I say concerned because these cases initially appeared over a month ago and were never reported by the Sheriff's Department. In the past month, we have had an additional 2 cases of coronavirus among inmates and 6 new cases among jail staff. Regardless of what you think about the sheriff's handling of the pandemic, we should all be able to agree that transparency is key to effectively overcoming this pandemic. The people demand accurate and prompt information, especially regarding taxpayer-funded liabilities like the jail. It is unfortunate the sheriff has chosen to be as opaque and cantankerous as possible. I was disappointed at the previous Health Committee meeting when Suzanne Scott, the Director of Jail Medical, was asked point blank if she had anything to report. She responded, no, not particularly. This despite her receiving at least 2 positive tests 5 days prior. I say at least because I don't know when the staff members contracted COVID. There are many questions that need to be asked by this committee. What laboratory is processing COVID-19 tests for the jail? By law, they, the lab, are supposed to report all positive cases to the local health departments. Yet there are no reports of this occurring. Why is the health department purposely omitting this information? Studies show that once COVID-19 enters an incarceration environment, prisoners are 550% more likely to get COVID-19 and 300% more likely to die. When outbreaks occur in corrections institutes, infection rates frequently exceed 65%. I am calling on the county board to pass a resolution asking the sheriff to report all COVID-19 cases in the jail promptly and accurately. This should be the bare minimum, but apparently we have to specify. You have a duty to the taxpayers to be fiduciary shepherds for the jail, but you can't do that if you don't have the proper information. It's time for you to prove you are concerned about a transparent and accountable government. Again, that was submitted by Zachary Gittrick. The second comment that I received was submitted by Bunny Maxwell. I have seen the circulars from Agitation Rising complaining about the sheriff and COVID with inmates. I support the sheriff. Jail isn't too different than a nursing home and the way they are dealing. I don't know what this group is trying to do other than they are the same ones wanting to defund the police. Inmates receive treatment. I am sure they aren't being abused. They can't be turned free to run the streets and expose everyone. They are in jail because they broke some law. Lawbreakers cannot be allowed to avoid punishment no matter how much these new groups want. Keep up the good work, jail staff and sheriff. Again, submitted by Bunny Maxwell. Those are the only two that I have.
Thank you. Moving on to departmental matters. First up is Jason Tabb from Juvenile Detention. Jason,
Good afternoon.
you have your report. Do you have anything you would like to point out to us or any comments that you'd like to make?
I do not, but I'd be happy to answer any questions.
Are there any questions for Mr. Tabb? Ms. Johnston?
Thank you. I know that we've not had any kids symptomatic at the JDC, and I was wondering if the staff gets tested on a regular basis like they do at the nursing home, or if that's something that you at the JDC have been trying to monitor as far as like COVID cases. I know we report, I think there were 84 tests done this year just for tuberculosis. And I would assume that there's been some COVID, but I haven't seen any reports. So could you speak to that a little bit?
Sure. The staff are following the protocol we set in place when this happened. If they show any signs, symptoms, they are required to report to the Interstate Center to get testing on their own, and they report back to us what their findings are.
Has there been any staff like any of the staff tested?
Yes.
Okay. Has there been any positive cases with the staff this year?
I don't know that I can speak on that with it being medically related. I don't think I'm allowed to comment on that.
Yeah,
Yes, ma'am.
if I may, Chairman Schaefer, may I speak? Thank you. Yeah, Member Johnston, we generally don't comment on the health status of our employees. And so you will find that we do comment on how many employees, for example, at our long-term care facility have tested positive. And that's because of the direct correlation between the requirement that we must report that to IDPH, and they in turn report it on their website. But in terms of any of the departments in McLean County government, we do not keep a public report of how many of our employees have tested and how many, if any, have tested positive.
Any other questions for Mr. Tabb? Okay, thank you very much, Jason.
Thank you. Have a good evening.
Thank you. Next up is Jessica Mcknight, Health Department Administrator.
Good evening.
Oh, there you are. Okay, I couldn't find you on my screen.
Here.
You have one item for action, which is a request approval of an amendment to a full-time equivalent positions resolution for fiscal year 2021 for the Health Department Fund 1010012. That's, isn't it 112?
112.
Yeah. Health Department 0061, Health Promotion 0067. And is there a motion? Motion by Bloomfield, second by Johnston. Would you care to explain this or talk about this, please?
So as mentioned in the memo, we've had a health promotion team member retire and a vacant position as well. So using this opportunity while it is budgeted to pool these two positions and bring on a public affairs coordinator to really work with marketing, public relations, maintaining that relationship between the agency and the public.
Are there any questions? Okay, hearing none, then Ms. Morlock, would you please call the roll and the chairman will vote.
Thank you. Member Bloomfield?
Yes.
Member Martin?
Yes.
Member Metzger?
Yes.
Member Chung?
Yes.
Member Johnston?
Yes.
Member Beer?
Yes.
Chairman Schaefer?
Yes. You also have your report. Anything you'd like to highlight on that?
Just highlight, it's not in the report, but I know people are probably curious about vaccines. So, as of when the report was submitted, I didn't have, exact numbers, but we've received to date, so another shipment today, over 6,000 COVID vaccines. So, it's going to be a slow process getting those out, but, we'll be having clinics weekly to get those. It'll probably take us at least a month, maybe a month and a half, 2 months to get through the phase 1A. So that information was in your packet as well. The phase 1A being the hospital staff, healthcare personnel.
Thank you. Any questions from the committee? Member Johnston.
Thank you. I just wanted to clarify, like the total number, this includes what the hospitals have received as well, or just what the health departments received? It's for the whole community?
Mhm.
Okay. Just wanted to clarify that. So thank you.
But it does not include the long-term care facility information. That's totally
No.
separate. We will not get any information on the long-term care facilities and what they've received and how they've received them.
Not till after the fact. So we will find out from IDPH which facilities had clinics, how many were vaccinated after the fact.
Okay, thank you. Member Chung?
Thank you. I guess you know how we received that shipment from Knox County, was it? Do you foresee anything like that happening, like a sort of windfall, I guess, in that sort of way? Because that was a sort of unexpected, I guess, sort of silver lining. Do you foresee anything like that happening? Also, the other question I was going to have about, so you said that there's several months that will through before phase 1A happens. I'm assuming that you're also coming up with plans for how to, what's the word, I guess, sort of make phase 1B happen as well. Because I've seen it's sort of news in other states, how their vaccine sort of rollout is has turned into some sort of, I don't know, it seems to be really somewhat barely manageable chaos where people are sitting outside in lawn chairs and signing up, and that way, I just really don't want to see like that happening here, especially in the winter months. But thank you if you can answer those.
Sure. So, answered that kind of first. We're following the lead, obviously, of Illinois Department of Public Health, and they are still ironing out. So after we get through phase 1A, which again, we'll be in that for a while, then we'll move on to phase 1B. And that's where things do open up a little bit more. And we're still planning because we're still getting guidance from IDPH on what all groups that will include. So for right now, for our healthcare personnel, we're getting that information out to them about when clinics are, how they can register. So by appointments seems to be working rather well. And if you let me know, the first question was about, the windfall about the vaccines. I doubt there will be another windfall like that. So as I included in my report, the Pfizer vaccine kind of came with a surprise. It's supposed to be 5 doses, and then ended up being 6 and sometimes 7 doses. So there were some extra doses then that were not initially accounted for. And so we happen to be a lucky recipient of that. But, we are currently receiving and expecting to receive regular weekly shipments. So I don't see any above and beyond that.
Any other questions? My question is, you said we've received 6,000. Does that include the second doses for some of those people, the original people?
Not yet. So we should be expecting in the next week or two, because we're coming up already on about time for the 21 days past the first Pfizer doses that were given. So IDPH is already working on getting that out to those counties, and including us, that we did receive on that first week. So right now, what we've got doesn't include those second doses, but they're accounting for each dose that is given, tracking that, making sure then that we can have a second dose in the proper amount of time.
Are you finding that because it's the healthcare workers that are first, are you finding that they're very receptive to this, or they not receptive, or is there kind of a mixed bag on their willingness to get the vaccine?
I couldn't speak for facilities and what they're seeing in their agencies, but I know, again, we've got a lot of interest. So a lot of people have been contacting us from healthcare facilities with interest of when can I, how can I? So that's very positive to me.
So then that leads me to my next question, because you have a call center set up already. And so are they receiving a lot of calls regarding the vaccine?
So they're just completing their training right now. So we should have more information coming out public-wise about that number and how people can get a hold of them. But we've been receiving lots of calls through the health department about the vaccine, lots of email and communication. So I do anticipate a significant number of calls, and that'll be a good resource for the public.
Thank you. Anyone else have any other questions? Okay, thank you very much. Next up is Suzanne Scott from Adult Detention Medical, and I do not see her on the screen.
If I may, Chairman Schaefer, it's Camille. Ms. Scott had to work the floor today. It's one of the bonuses of hiring her. She's very willing to work the floor. I'm here to represent her, and she does not have any items for action. Her report is located on pages 29 through 32 of the packet you received from Ms. Morlock, and I can try to answer any questions that you might have about her report.
Does anyone have any questions regarding the report? Member Johnston.
Or do we have any restrictions on reporting COVID numbers of inmates? I mean, what I'm hearing is what you said before about with JDC about not reporting on staff members, but I can see in the report that we had, 14 medical transfers in November, and there were 13 tests done for COVID. Is there any way for us to know how many positive cases are in the jail and kind of understanding? I know that they go through a protocol to keep them isolated and to allow them to quarantine so they're not spreading in the jail. I just think it would be helpful to be able to share that information on a regular basis.
I can't speak for any specific restrictions. I do know that Sheriff Sandage is very happy to address that with any of you. Purely from my own standpoint as a former public health professional, I do get concerned about statistical significance relative to reporting on such low numbers. And so when you're talking about then reporting specific, if there are any positive COVIDs ever in that facility, it becomes like that. When I was in Wisconsin, we had an opioid epidemic, and we could not report on overdose deaths in certain counties because the population was so low. I can't really speak if that's the situation in this case, but I can assert to you that Ms. Scott and her staff, as well as the rest of the correction staff, are following all those protocols that you mentioned. And I'm certain that Sheriff Sandage could answer more questions for you.
Any other questions? Member Chung.
Thank you. I guess my other question was that if there was, when was this? I guess over the summer when there was an outbreak in the jail, the sheriff said that there was, gosh, now I'm trying to remember what he said, but everybody was being tested quite regularly. If there's a sort of outbreak right now, or if there are positive cases, is there a sort of threshold as to when this sort of like rigorous testing is happening? Am I being clear on my question?
I think so, Member Chung, and I can try to be clear on my answer. An outbreak is only 2 or more people, right? Just 2. And so, I mean, we often hear the word outbreak, and if we're lay people of public health, we think, oh my gosh, that must mean 25 or 50 or 100, but it means 2. And so I certainly am not as fluent as I am about the nursing homes protocols relative to how much testing is done, but I am certain, of course, that the sheriff could expound upon that too. It is his facility, and certainly the nursing staff, as represented by Ms. Scott, follow all of those protocols set in place. But I also know that even when folks are symptomatic, they're going to get a test And whether or not staff are tested at the rigor with which, for example, Ms. Edens has to test her staff, I can't explain right now, but we will certainly be happy to get you that information.
Yeah,
Thank you.
I'd just like,
And since I'm on justice, I can also ask him tomorrow. So thank you.
Oh, very good. I forgot about that. I'm sorry, Member Chung. So yes, you can ask tomorrow night.
I will.
Thank you.
yeah, yeah, if you have questions, specific about the jail, I definitely would direct them, even if you're not on justice, if you have questions, to direct them to the sheriff, and hopefully he'll be able to answer those questions for you. So, anyone else have any other questions? Okay, if not, move on to Ms. Edens from the nursing home administrator.
Well, Happy New Year.
Happy New Year. You have no items for actions, but you have your general report. So I'll let you just kind of talk about that for.
Okay. Don't really have anything to push through other than to kind of touch base on what Jessica talked about as far as the vaccine. We do have the vaccine scheduled for here to arrive on January the 12th to start with our residents and our staff. We have Walgreens coming in to do that. So they will be here the 12th, and then I believe it's on the 23rd or the 22nd, and then the first week in February. So a little bit, as far as employees go, they're pretty much all saying yes. A couple of them on the fence, but for the most part, the employees are saying yes. A couple residents still trying to convince, the families are trying to convince the resident that yes, you do want it. So we're probably about 50% done with the residents as far as, or 50% saying yes right now. So we had a bad bout of COVID go through, and glad we're back down on the downhill slide now. So right now we currently have 5 employees, no symptoms, and 5 residents with 1 in the hospital. Does anybody have any questions for me?
Member Chung.
Thank you. Thank you, Ms. Edens, and Happy New Year to you too. I guess I have a couple of questions. Back in December, I guess it was November 30th was like our last health committee meeting. It feels like ages ago. That's when you had reported the first sort of initial cases that had been in the nursing home, because at least for residents. And, it sounded, I guess at that point, at that time, it sounded that you had things under control. And I guess, I at least from what I understand is that a number of residents have passed away from COVID. And I guess I'm trying to figure out the best way to ask this, but I guess it's just, is there a way that you might approach things, I guess, differently? I know that you say numbers are back down again. Are there other things that you think that you might do differently to prevent anything like this from, I guess, expanding again? And I guess I have another question, but I guess I'll save that for a little bit later, but I'll let Ms. Edens answer that.
Well, the first thing, I don't know the information as far as the deaths go, if it's from the radio or the newspaper. I don't know where they got their numbers, but we've currently had 14 deaths in the building. And according to our infection control, we've had 6 COVID deaths and 8 were other. They had other comorbidities that caused, could have been heart trouble or COPD or, I can't say for each individual one, but I do know that we have had 6 deaths with COVID. We currently do have 1 gal in the hospital. But other than that, the numbers that are coming out, I don't know, every day I see the newspaper and every day I hear the news and every day I come back in here and say, where are they getting their numbers? Are we not counting right? Are we not doing this right? And I know we report everything to the health department. And so I don't know. I just know since the pandemic started, we didn't have any residents until November. 1 here and there. Well, we had 1 new admit, I think, in October that came in with it. And then in November, I believe we had 11. No, we had 7 residents in November. We had 11 staff. But December, I don't know why. I mean, we haven't changed anything. We're still using full PPE. We're still hand washing. We're still in-servicing. They're wearing everything. I mean, I'm not sure, other than everybody's out and about. So, I mean, it just takes one, to come in, and then it just, we were as flabbergasted as you are. Trust me. And I was beside myself. So it's just unfortunate that, that it is going through. And again, like I said, our numbers are down now again, but, and hopefully it'll stay that way. So, I can't promise that, of course, but, my nursing staff and myself are doing everything in our power to, keep it out of here as much as we can. And, we just keep educating and keep enforcing that wash your hands, I mean, no matter what, whether you're at home or here or wherever, we go through a lot of this, hand sanitizer here. So we're working on it. I mean, I don't know what else to say.
No, I thank you so much. I know it's a really difficult thing to talk about, and my heart goes out to the families of, people who have passed away from COVID, and especially from our nursing home. And I know that, with the nursing staff there, that they really, you all care about every single resident. So when you see things like that happen, it just really has to break your heart. So thank you though for your openness to answering that. Is it okay if I ask my other question right now? Okay, thank you, Chair Schaefer. My other question, I guess, is with the vaccine. I guess what I was thinking about was, how you're having this plan for all the residents to get vaccinated. If new people come in, I guess, will you, I guess, make sure that, if new residents do come in, will you make sure that either they have their vaccine, or maybe bring in like Walgreens again to do vaccines for them especially? I don't know if there's any plans for that, but that's something I was just wondering.
We are, actually, we were talking about that today. Currently, I'm not taking any admissions. I want to make sure that our COVID numbers are down and stay that way. So I put a halt to all admissions, and and I hate to say that out loud, especially with the county administrator sitting there, but we're doing that in the best interest of everyone. So hopefully by next week, with us being down to 5 residents with it, we'll be able to start admitting next week. And the answer to your question is yes, we've discussed it. They will have to have the vaccine before they come in. We will still do all the CDC and IDPH guidelines as far as putting them in isolation and quarantine them for the 14 days. So we'll still follow all the same protocol, but we will request, yes, that they get the vaccine. And most hospitals are planning to do that, I think.
Chris, did you have something you wanted to say?
No, I'm good. I was just concerned, and I wanted to be ready in case something needed to be said, but I think everything was fine.
Thank you.
You're welcome.
Thank you. Yeah, I think it's a challenge when there's so much community spread that no matter where you're at, whether it's the McLean County Nursing Home or any other nursing home or assisted living facility in the community, I think that it's a challenge for every single one of them to keep all of their residents safe. So I think we've done a pretty good job, and hopefully, I think that when you read IDPH's website, they just give you a number, and they don't give you the explanation that you have given us on the number that were actually COVID deaths versus other reasons for death, because we are a nursing home and there are elderly people that have other issues. So I think that is very good to explain that difference instead of just looking at a number. And anyway, anyone else have any other questions for Ms. Edens? Member Martin.
Thank you, Chairman. When you talk about the vaccine that you've received, is it Moderna or Pfizer?
I don't know, to be honest with you.
Okay. And
I can find out. I just know that it's supposed to work.
Well, they're both supposed to work. The other question I have is, and I understand that because you have a contract with Walgreens, that you have to accept, you can't go anywhere else other than Walgreens. Is that a correct statement?
I don't think so. I mean, I think that, you know, if our employees would rather go to CVS, they can do that, or go in, you know. Now, resident-wise,
I'm
because
talking about resident.
yeah, resident-wise, I think it's whoever we bring in. But I think if anybody had an objection to that, we could probably work that out. But it's, to my understanding, no, it's not a have to. I could be wrong, but I'll find out. I can find out for sure, Mr. Martin, and let you know.
It was a discussion we had earlier today here at work, and I was just wanted clarification.
Okay, I'll get that clarified for you.
Anyone else have any other questions for Ms. Edens? Member Johnston.
Thank you, Chairman Schaefer. Thank you, Ms. Edens. I want to thank you for the reports that you give. It really paints a picture so that I can understand what's happening as far as the care that's being given to patients, and that means a lot to me because I think that we need to be, I think we do administer good care as an organization, or that you do at your organization. I just had a couple of quick questions. The first one is, I mean, having worked in the PPE, like in the mask and in the face guards and everything with patients day in and day out, you lose some of that touch. And I wanted to just question, I wanted to get a sense how the residents, you see I work with patients, how the residents are faring with that extra barrier between that human touch, and how the staff is doing as well.
Well, the staff, it's very hot. If you know, I mean, when you wear those gowns and things all day long, they are very hot. But they relieve each other. So one will come off the unit, another one will go on, to kind of give them a break. So the staff, you know, they're doing okay. They're doing what they have to do. Residents don't seem to mind it.
Okay.
A lot of times, the one when I went in to talk to one of the gentlemen the other day, and, you know, come in fully garbed, he says, "Oh, you're looking beautiful today, Miss Edens." He says, "I love your outfit," you know, because we all look the same. So he did say that we need to write on our gowns or something our names. So most of us on our, well, you can't see it from here, but on my shield, I have my name. So a lot of them put their name on it, and that seemed to help a lot. So that way they at least know who is in there. So yeah, so they've done very well with it. Activities has done very well, trying to keep them as busy as possible. Most of them, you know, are content with doing nothing and just sitting and watching people. So.
Okay, thank you. The other question I had was just kind of quickly on the recorded monthly expenses and revenue. Is this just our cash flow on the nursing home, as specifically what cash went out that month and what cash came in, as far as kind of income and expenses?
I think it's, yeah, all incoming or all expenditures and revenue, and I don't have that in front of me. And you know what? I did notice on the report that there's no revenue on there, but we did make some.
Right.
I noticed that today. It's like, oh no. And I thought for sure I put it on there, but the expenses are what went out, of course, what we paid out, and the revenue is what we brought in.
Right. So this is the cash numbers. And I don't know if this is something that you would be willing to put out, but it would be interesting, I think, for us to be able to see what we're billing for as well, kind of like what's outstanding, because I know that there have been delays, and I know that we don't get reimbursed at adequate rates, particularly for Medicaid at this point. And so I think it would be helpful for us to make sure that we understand like what value we're providing and what we need to try to fight for, maybe at the state level as well, as far as increasing the reimbursements.
I do know that my MDS coordinator, actually, when I got the report that is statewide, it tells you how much you're getting per patient per day from the state. We're pretty high up there. I mean, she's done a really good job at capturing the restorative programs and the programs that we need to get us that more money. We're not the highest, of course, but we're doing pretty good with that. I do know that. And actually, I think we just got paid by Medicaid, so that was a plus too.
Okay, thank you.
Yeah. Yeah, so I am
think
keeping
if
track.
I think if you look at page 37, that kind of answers your question on the monthly transaction types by what the charges were and what they've
Mhm.
received. So that might help you answer
Okay.
that question.
Okay, thank you.
Thank you.
Anyone else have any other questions for Ms. Edens? If not, thank you very much. Keep everyone there safe.
Thank you.
Next up, we have Ms. Rodriguez, County Administrator.
Thank you, Chairman Schaefer and Health Committee members. I do not have any items to present for action. Before I do address my report on recent employment activities, I think it goes without saying how much county administration appreciates all of the department heads represented here tonight. They're doing so much work to uplift their staff during this time and keep the people that live with them safe. And I'm just really proud of them. I take calls at any time from them because it's just so important to support them. And I feel like I don't do enough. But I'm just letting you all know, Ms. Mcknight, Ms. Edens, Mr. Tab, hopefully I haven't missed anyone, that we appreciate you very much. We have a Scott. Ms. Scott, and she's working, right? So you have to appreciate Ms. Scott as well. Thank you, Ms. Metzger. It just goes without saying, they are doing so much. They work all of the time. We have a report on page 38 of recent employment activities. Those are hires in particular departments. I'd be happy to answer any questions that you might have. Thank you, Chairman Schaefer.
Any questions for the County Administrator? If not, I would like to make a comment is that all the groups just about that report to the Health Committee work 24/7, 365. So they probably are some of the hardest working employees that we have. So that and the Sheriff's Department and the Highway Department are probably about the 24/7 operations. So yes, I do also agree with thanking them on their work. And we do have a light at the end of the tunnel. So hopefully it won't take as long as some people are saying it's going to take. Under other business and communication, we have proposed meeting dates in 2021, not 2020. We've gotten rid of 2020. Okay, let's get rid of that year. We have several dates that have to be changed because of conflicts with holidays. And the only one that I see that could potentially be an issue is the Wednesday, June 2nd one, which is at 3:00. And I know that there are several people on the committee that do have full-time jobs that this is just the one time that would be earlier than the 4:30 meeting. So other than that, are those dates, if we can get a consensus of dates and times work for most people, we'll go with this schedule for 2021. Does there anybody have a problem with that? Okay, so what our dates are, Julie. So we'll just move on from that. Other than that, does anybody else have any other business or communication? Chairman McIntyre, did you have anything you wanted to say? Nope. Okay. We'll move on to bills. We have.
There, I think I got on. You hear me now?
Okay. Yeah.
As the year unfolds, we're going to have some major issues before us as a full board. And I think you'll see more and more why every one of our committees that's formed is very important, because we have not only the COVID issue, it's still ahead of us, and the vaccination distribution, but so many other issues that we're going to have that come down to us, especially things like the budget situation from the state, the finance committee things. Our property committee will play an extremely important role this year with a number of projects that are unfolding before us. And so any committee that you're on is very important so that the work is done within the committee, and that there's going to be some tough decisions. So I appreciate all that you're doing, and we'll just stay on top of everything the best we can. We'll try to get as much information as we can to you. I know we had our executive policy group conference this morning, which involves the health department and emergency management and all of our county department heads. And we're trying, and I conduct that meeting just to keep everyone up to date as much as possible because of the ever-ending changing things that happen. I just noted in watching the meeting, you know, this vaccination program through our long-term care facilities is coming down from our federal government as opposed to what we're getting through our health department. And the more that we can clarify information so that misinformation is not misinformation or misinterpreted, the better. And so on the leadership role by departments, and that includes state's attorney, sheriff, health department, regional office of education, we're all communicating to keep abreast of the changes. Sometimes we don't know much more than you do because things come out so rapidly. I also note that was mentioned too that our media doesn't really know at times, and they're getting information that sometimes is handed down or is not correct. One example is the Illinois Department of Public Health report on deaths that are related to COVID, and they're not necessary, and sometimes they're late, and sometimes they are written down and contributed to COVID-related things. But our nursing home is a good example of people that were on hospice already. And so it's difficult to sometimes have a good feeling or good numbers on those kind of statistics when they come down. We'll try to do the best we can from this end. Thank you for all of you doing it. Welcome new members. And hopefully we can have a good year. It's going to be a very important year for all of us. Thank you.
Thank you. Okay, so now moving on to bills. Nursing home has a prepaid total of $363, 830 and 42 cents. I can't talk today. It's Monday. Is there a motion? Motion by Bloomfield, second by Chung. Is there any questions? If not, Ms. Morlock, would you please call the roll?
Member Bloomfield,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Chairman Schaefer.
Yes. Jail and JDC Medical has a prepaid total of $54,550.98. Motion by Johnston, second by Chung. Ms. Morlock?
Member Bloomfield,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Chairman Schaefer.
Yes. The Board of Health has a prepaid total of $434,043.19. Is there a motion? Motion by Martin, second by Bloomfield. Ms. Morlock?
Member Bloomfield,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Chairman Schaefer.
Yes. And Developmental Disabilities Board has a prepaid total of $4,986.44. Motion by Johnston, second by Chung. Ms. Morlock?
Member Bloomfield,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Chairman Schaefer.
Yes. We also have 3 transfers. They're 3 separate funds, so if the committee doesn't mind and Mr. Spanos doesn't mind, I'd like to, because they're all for the health department, but they're 3 different funds, combine them into one. If Mr. Spanos has an opinion other than that, if the committee doesn't mind, I would, okay, Mr. Spanos. We have 3 transfers from the health department for Fund 103, 106, and 110. Can I have a motion for approval of those transfers? Motion by Chung, second by Bloomfield. Any questions regarding the transfers, any of them? If not, Ms. Morlock.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Chairman Schaefer.
Yes. And with that, we've completed our agenda. So this meeting is now adjourned. Thank you. Oh, did you have something?
I just quickly, you had asked earlier about medical providers and how the enthusiasm for the vaccine. I work in 2 different clinics, and I have to say it was sort of like getting a golden ticket. Like everybody was very eagerly looking forward to getting their vaccine. And I would say the majority of both of the offices I work in, which is about 80 to 90 personnel, the majority of them I think have already been vaccinated. So from my perspective and what I see, personnel is very enthusiastic about it. So I'm hoping that will help spread.
Yeah, my son works
Spread the vaccine.
in a very large hospital, and yes, he gets his next week, and he's kind of excited about it. So yeah.
Yeah. So.
Anything else? Okay, we are adjourned then. Thank you.